this is what we call it as a self-cupping tube or connecting tube as well. So basically, if you want to do for yourself, you can use this, like you can connect it, then you can use it for yourself. Okay, so see, so you can use it for yourself also wherever you want. Okay, so what we'll do, we'll use it. Okay, before that I will show you the amount of vacuum. Okay, so it is mild, moderate and severe. Mild is just 1 to 2 pumps. This is mild. Okay. Mild, moderate, okay, and severe is maximum. Mild, moderate and severe. Whenever you are doing dynamic cupping, try to keep the vacuum either at mild or moderate, not with the severe. Okay, so whenever you want to release the vacuum, just pull this bulb. Okay, so now I'm going to do dynamic first for her. Okay, so this is what we'll do. Okay, so you can do dynamic in both the direction, to and fro. So upper trapezius, supraspinatus, then rhomboides minor and major. This is infraspinatus, right? So this is what we are doing dynamic. Okay. Okay, just we did it, I think 30 to 40 seconds, right? You can pause it. Okay. So 55. Then 20, 21, then this is, we call it as a rotatory cup. You can increase or decrease the pressure of the vacuum. Okay, so at 4, see, if the patient is feeling uncomfortable, you can decrease it. Okay, at the same time you don't need any external gun with this. Okay, then you can put the 4 and 5. Okay, if upper cervical is involved, in that case what you can do, you can use a smaller one over the C3, right? Yes.
Hmm. 41, 42, 43,
40, 41, 48.
Yeah, 43. हाँ वहाँ पे
Okay, so along with that, this not right. Can you get the pen?
give it.
Okay, so yeah. Okay, fine. So the pectoral muscles, then upper trap, rhomboides minor major, supraspinatus, infraspinatus, subscapularis, and deltoid. Okay. After that, what you can do, you can apply the static one. Okay. So I'm just applying a static one. Can you get the oil? What you can do? Yeah. So start it. Yeah. So for the frozen shoulder, what we'll do? 2021. Yeah. Then over the 4 and 5. Okay. 1 over the deltoid. Middle fiber. Okay. 1 over the junction of teres minor and major. Okay. 1 over the pectoral 115 or 116. Okay. So okay. Then you can put 1 just below the inferior angle of the scapula. One in the side over the subscapularis muscle. Okay. After that, what you can do, you can ask the patient to do the movement. Okay. So, right up. Okay, I think drop it. So like this to the dynamic triceps. Same way you can put over the triceps, you can release dynamic. Okay.
This is for
Children?
yes.
This is for biceps. And for the bicipital tendinitis also put over here. Okay. Then 1 cup you can put over here. Okay. So just take put 1 cup over here. Like this you can. So try to use and see for the frozen shoulder.
He did like this, same way. Yeah. You have to place it and just do the movement. ಎಳೀತೈತೆ
Okay, so see. So it's nothing like that you do like this. Okay. Don't do like that. See, you should be very quick.
It will not become very hot now.
No, no. Is it very hot? No. See. And you don't have to press also. Just see. Okay. So you can do it anywhere. It's nothing like that. Only in back you can do. You can do it anywhere, on the shoulder, on the neck, wherever you want. Okay. So what I want everyone to practice at least minimum 20 times. Okay, so that you will be frequent in that. Okay. Yeah. 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 Now, either you can use the forceps or you can use this one, both the things, no problem. This one, it comes in this set, okay. Okay, so, okay. See, make sure you are not hitting the edges. See. So you can use dynamic plus static. See, okay, if you want to use dynamic, see, you can use dynamic with the horns. With the bamboo as well.
So the direction of the
Dynamic,
should be
you can do it in any way,
any
like along the
directions.
fiber or crossing the fiber, anything you can do.
One.
4 and 5. Then like before putting the static, you can do dynamic, release the palace panel. 7 and 8. Should have been little bit outside.
Oil.
You can put, I'm going to do in dynamic, that's why, in order to not to spoil your dress, right? Okay, so can you do the movement now? The cat and camel. So what you will see, you can see at the same time you will see that okay, the movement is increasing. Okay, Just after. See now we come. Okay, because of this dress restriction and all. Okay. So immediately you can see the result. Okay. So this is. Am I comfortable? You want something here? Some towel or? No, not it. Okay, so now what you can do, the movement you can do like standing in on one hand and then do this. Yep. And take your hand here, straight here. Sorry. Okay. Chalo. Both the hand, like one hand alternating here. Even you can do it in this. Okay, that will be better. Okay, then this. Okay. So whole like even the hip flexibility will expand. Then all these like side muscles and okay, all these muscles, erector spinal muscles, then even the quadratus lumborum which will get stretched in this okay, and release in this. So you can do it in this way. Okay. Suppose if someone has got one side like tightness, okay, they are not able to do this movement properly. Okay. So in that case, what you can do, just apply that is mainly because of the tightness of the that is my jaw side. Okay. So in that case, you can just put it in this line, like this one. Okay. So this one will be the put one cups over here as well and remove this side, and then ask the patient to do this. Okay. So you can try on yourself, okay. You can do while putting the cups, even if you want, like you can ask the patient to do like this, okay, this movement. Okay. So that the spinal flexibility will increase. Okay. So for all this back pain and all in that those cases, you can do.
It's stretching. Yes. I can do this. Now do this side. Now do this. Do this. Yeah. Perfect.
Mother back is perfect.
Okay.
You can release the piriformis muscle dynamically, then hamstring. And So you can release it along the fiber. Okay. After releasing the piriformis, you can release the hamstring. And the popliteus going to the calf, you can release calf as well dynamically. Okay. Once you have done that, after that 1 and 55 will be the common. 11, 12 or 13 depending on the side. So then 26 or 27 depending on the side over the GT. 51 and 52. Then over the hamstring area, 2 cups, okay. Then over the popliteus, okay. After that, okay. So if you want, you can put.
It's coming off again.
Calf is very tight. Okay. That's the reason. After that, if you want, you can do the movement as well.
It will fall.
Okay. So you can do. Can you just come a little bit towards me? Left here. Yeah. 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 So fine. So you can do this. See. Okay. So easily you can see the movement. Okay. Okay. So you can do like this.
Opposite.
Then if you want to round it like this. So you can do it in any way. The thing is like you need to release this out. See? See, a calf is like very tight. Okay, so you can release the calf as well. Both the veteran is medial and lateral, so you can use. Okay, like this you can. Okay. Then if you want, you can do the movement as well. So Same way for you can put in all these three muscles, okay, like this. So just I will show you. Uh, okay. So like this you can, if you want you can just spread it a little bit more, okay, then put more cups in between. Okay. Same way you can do for the quadriceps, okay. If someone has got the medial knee pain, okay, medial knee pain, just apply over the vastus medialis. Okay, we release the quadriceps and apply the cups. The TFL and all. Okay, I will show you TFL and can you just come in the side lane? This vastus lateralis. First do dynamic. See, like she had the varicose vein, okay, visible. Once you have done the dynamic, it will go down.
Go.
Yeah. See, this is there, no? You can see, okay. So if I will do dynamic, yeah, but it will be painful, okay. So see, because what will happen, it will like do the movement over here and the all this black blood will get dispersed, like, not in the varicose vein.
For DVT.
Deep vein thrombosis, because the reason in DVT is like if somewhere the thrombosis is lodged and you are increasing the blood flow, so that might get dislodged and it can reach the brain, okay. So like see, she has got over here, so what you can do, just use this, okay. So it will
Less.
so see, then put the cups over the TFL. Okay.
So there's no position of the muscle, no, like in a lengthened position or in shortened position while
You can do it in both the ways, nothing like that. Okay.
So only the hijama pen, no?
Hijama pen and lens. So what you can do, you can use this facial cups, okay. So like you can use the same pattern in case of facial palsies or Bell's palsy cases.
Nothing about the directions.
Upward direction, not the lower one. Okay. So for the skin toning as well, you can use it in the same pattern. It should be always upward direction. Even you can use the smaller one. Smaller one.
It's in that cover.
You can use body eyelids. Close your eyes. You can use it in order to decrease the dark circle as well. Okay, so okay, so just compare. Okay, or tension headache. In that case, also you can release the sternocleidomastoid and scalene muscles. So what you will do? See, so okay, so you can use the so by this way you can easily release the sternocleidomastoid muscles. Okay, so what you can do better, you can keep like head like this so that easily it will be comfortable. Okay, and that's it. Okay, so you can see, or like sternocleidomastoid muscles is also very tight. Then all these muscles are very tight. Okay, so again sometimes the patient have got the pain over this area. In that case also it will be the tightness of the sternocleidomastoid muscles. So release it. Okay, put the cups over here for a few minutes. That pain will go off. Okay. So, so what you can do? Okay, it comes like this. So if you have got the equipment which has got the thick pin, okay, what you can do? You can remove this pin and you can get it changed. If you have got the like any like a Johri and all, it will, this pin will fit. Okay, so or else this that will fit. This is Johri 10. Okay, you will save your treatment time. Okay. Can you get the gun? Okay. This section come. Yeah. So so you can use it in the way you are using your tens. Yeah. Yeah. So try to increase the intensity very slowly. Okay. Don't increase it too fast. You started? No? Yeah. See, you can see the contraction easily, okay? And just see the intensity over here. It's below 2, 1.5. So at the intensity of 1.5, hardly the patient gets the feeling, okay? And you can see the contraction in this here. See, easily you can visualize at 1.5 intensity, you can see the decoy effect. So anyway, you can put, it's nothing like that. Like if you want to put for the shoulder joint, you can put for the, like if you want. Can anyone take the pic with all of us? Yeah, come. One people can take demonstration. No? Who is taking the pic? Okay. One person can take the pic from here so that everyone will come. Okay. So what we'll do? Okay, so this is.
See the mild movement happening. See, very nice.
Look at her relaxation.
Video agate.
Distracting us. Yeah.
Idea.
So much.
ಬಿಡಬೇಡಿ ಫಾಸ್ಟಾಗಿ ಮಾಡಿ. What do you do?
Let's see. If you want better, no, like what you can do, you can get it like.
Now it is okay.
Yeah, 5 minutes now.
It
is become red.
Pain, sometimes the patient have got a pain over this area. Okay, in that case also it will be the tightness of the sternocleidomastoid muscles. So release it, okay, put the cups over here for a few minutes, that pain will go off. Okay? So, yeah. Okay. With the silicons, you can do easily with the yeah, you can do that. You can release it. Okay. So try it. After that, we'll start with the part 2. So sterilization should be in one direction. Okay, it should not be like this. Okay. Okay. After that, put on the cup.
So that already they have put some other problems.
Okay, we'll wait for 2 to 3 minutes. Okay, so this is the what you have to do. You have to like take it out like this. So this will be the handle side. This side it will be handle side. So easily you can hold it. Never open completely. Okay, so just hold it like this. Then mark it again when you want to throw it. Just keep it inside, okay, and then you can throw it like that. You can ask the patient to have, okay. So what we'll do, so just have a look, okay. We are not marking the deep incision, just
Put it on.
I'm not marking much. Nothing like that.
So how do
So it was very superficial, okay. Put the cups over here, then are you all in?
Yes, sir.
I'm just touching it, okay. There is not much of the blood, so what you can do, don't just pull it, okay, just hold it. No, it's okay, fine. You won't carry back. Are you all right? So you cannot see any marks, right? So that is what, okay. So you can just put this don't bend the needle, okay. And this, like, you can use it here. so you can use it fastly. So okay, so now all right. This one is more easy.
And it will not give deep cut.
Yeah. So there is no chance like in that if you like so this one is fixed right. Okay. So this black mark it will go in 2 to 3 days.
Cotton. Put here first. Put tissue.
I'll use some more pump.
Yeah, no, I think your cuts are very less.
Yeah.
And very far.
Yeah.
Little close it had to be.
That big thing is.
You could have pricked a little more and then put this cup.
Now you want?
It's okay, you can do on this side. Try on this side. Ago tumudi ile.
I'll try for you only on this. Using this. Done.
Okay, done.
Arre. Done?
Yeah.
I'll do this.
Okay.
Should I do the sleeves?
It is wiped, no? Can I touch it again? To feel it went. I can hold it.
Yeah.
Asan go?
So plan.
In the junction, you're not holding the junction. Now we will get the proper force. See.
That's not possible. See,
Kai pain nani.
universal size you can take common size you can take 25 and 40.
It will hurt.
That is common.
Yeah. Yes.
It's inserted.
Yeah.
It's done. So I'm just trying to keep myself relaxed.
Relax, Ra.
You just hold this under here. Right? Yeah.
That grip you're not getting, Mare. There only it was. No, hold little, like that. Little more in you hold. Okay, fine. Yes, perfect. Catch her. First hold there, then you can drag yourself back. Don't bend.
We're getting twitch.
She's saying no.
How will come to know? It's not hang
That
like
you
that.
Muscle
When I
contact.
was the model, how you got to know?
I didn't see actually.
How you got to know that?
I did on
Sir
you.
was sir was telling me feel muscle twitch.
Which that you can feel. So when I'm hitting you, you can feel that. So you can yourself feel it.
No, I felt.
You know, sir, when he put it in, you will understand the tight thing that it is putting something.
See the muscle sir was telling. See the muscle.
उस पे to and fro करके दिखाना मुझे. I know, but just do it slowly.
Yeah, I will put this off. Okay. Hold down, push down. Little more up, not so down. Right.
Go down a bit, yeah. Little down. Not the angle, yeah. Okay. This side, yeah.
Perpendicular, no?
Tap to hold. Tap fast. Done. Didn't pain. Now slowly push.
Just push it in.
So that this tempo is proper. Otherwise you like soft touch you give. Good, very good. Push.
It's-
Slowly push.
Real side of the thigh. Okay, so externally rotated and slightly flexed. Okay, you can support over here, give the support over here. Yeah, so can I get one till all that towel? So no problem, just yeah. That is transverse direction, you can say as well. Okay, so medial to lateral. I've seen that pitch. Okay. Okay, I want only one phone.
Yes.
You will get the video, okay? And you will get the nice video. That's the reason I'm going to demonstrate dry needling for the multifidus muscle. Basically, for the multifidus muscle, it originates from the transverse process of C3 till the L5 get inserted into the spinous process. So what we'll do, we will first palpate the spinous process. You come over here, come with the external occipital protubulance, the first bony landmark in the occiput. That is, you can palpate on yourself. It's the external occipital protubulance. Okay, from external occipital protubulance you come downward, okay, with the pulp of your thumb. Okay, you will land up in the fossa, that is suboccipital fossa. That is your suboccipital fossa if you try to palpate. Okay, suboccipital fossa. From suboccipital fossa you just come little bit more down. The first bony landmark will be the spinous process of the C2. So that will be the spinous process of the C2. Okay, then C3, 4, 5, 6, 7. From here, from C3, what you will do, you will try to palpate the transverse process. So come 4 cm lateral, 1 to 2 mm down. 4 cm lateral, 1 to 2 mm down. Okay, this is what basically we have got the transverse process. Okay, you all right?
Yes, sir.
Okay, so like this. From here, okay. So basically this is how this multifidus runs till L5. Now in order to palpate the trigger point, if we cannot palpate it, so what we do, we take a reference landmark. Okay, and reference landmark will be 1.5 finger breadth of the index finger of the patient, not length, breadth. Okay, with index finger of the patient. So what we'll do, her 1 finger is, her 1.5 finger will be my 1 finger, right? You can see. Okay, my 1 finger is her 1.5 finger. So see. Okay, so what we'll do, 1.5 finger breadth of the index finger. Okay. Okay, so this is what basically we have got the infraspinatus muscle. Basically the patient will give pain deferral pattern in the medial, this area, and this area and posterior side of the arm. Okay, you will get 3 trigger points in the infraspinatus muscle, 2 just below the spine of the scapula and third one at the medial border. So try to palpate. Yeah. Yeah. Okay, the second one here. Okay, so one is this, one is the third one at the medial border. Say this one. Okay, now the infraspinatus fossa is very thin. Okay, sometimes there will be already hole, that is congenital deformity. We call it as a hiatus of the scapula. Okay, so we should avoid coming towards this fossa line. Okay, what direction is left for these two? What you can do, you can go superiorly towards the spine of the scapula. For this one you can go medially. The needle size will use 25 mm. Okay, so with this what you can do, the angulation should not be less than 45 degree, or else it will go in the superficial layer of the skin.
So that was what direction?
Medially, and this is superior. I can hit the bone. This is for infraspinatus. Basically, the patient will get pain in the medial border of the referral pattern, in the medial border of the scapula, then this area and lateral side and posterior side. Clear? Any doubt in this? Rectus femoris, the pain referral pattern will be interior side of the thigh. Okay, around this area. This is ASIS. Okay, it has got origin from the anterior inferior. Okay, this is superior, right? Inferior is somewhere here. Okay, so approx like 4 to 5 finger down the ASIS. Okay, approx 4 to 5 finger down the ASIS. If you try to palpate in the line of GT, okay, on yourself, you will feel a tender point.
Yes.
Right? So this is what it will be like completely a band type. Yeah, this one. Okay, so this is what. Yeah. Okay. So this is what we have got the trigger point. Needle size 40 to 50 mm depending on the bulk of the muscle. See, can you get the sensation? Okay. Needle direction will be perpendicular. So I am just using 60 mm for her perpendicular. Okay. See, it was a pitch. Yeah, I can hit the bone now, right? So I can hit the bone. Clear? So this is for rectus femoris. Around this area. Okay, we have got the adductor canals this side, so we have to avoid going towards this side. Okay, you can get all the so many trigger points again, so you can use direct or indirect approach. If the trigger points are in the same line, you can use the indirect approach, that is threading technique. See? Needle size 25 to 40 mm depending on the bulk of the muscle. Okay, so I will be using 25 mm for her. In the same pattern, what you will do first, you will landmark the patella. Okay, so try to palpate the all the four border of the patella. So this is what we have got. Okay, so okay, so this is what we have got the patella. In order to reach patellar bursas, what we will do, we will approach through this corner. We will approach through this corner. Okay. Then along with that, you can do, this is quadriceps tendon, patellar tendon, medial collateral ligament, and lateral collateral ligament. This you can do it for generalized knee pain, knee fusion, osteoarthritis of knee, any cases. Okay. So for the patellar bursas, we will be using 13 mm. If the patient has got more of knee fusion, you can use 25 mm, or else for other 25 mm. Can you get this anywhere here? The direction of the needle for the patellar bursa is towards the corner of the patella, towards the corner of the patella, and for these all these tendon perpendicular. Okay, so okay, so now for the tendon we'll be using 25 mm. Dry needling for the teres minor and teres major. Okay, so basically this is what we have got. Okay, so this will be your, then this is the teres minor major. This is what we have got the groove in between, gap. Okay, so this is teres minor and this is major. Okay, now for the teres minor, again the pain deafal pattern will be this side. Okay, this side, and teres major it will be more of the inner side. Okay, it will go to the posterior side of the elbow. Okay, you will get one trigger point in the teres minor. So see this one. Okay, two trigger points in the teres major. Okay, one will be, see, one and one just above the axilla. You have to avoid going towards the medial side. Okay, towards the thoracic area. Okay, so what direction is left? You cannot go superior also, because we have got all the axillary vessels and all coming out. Okay, so direction will be inferior and lateral. Okay, needle size 40 mm, 40 to 50 mm depending on the bulk of the muscle. Okay, so I am using 40 mm for how? If you want, see, you can do to and fro, twisting, twirling in.
So directions also, or it should be
Inferior and lateral. Inferior means downward and lateral means up. Okay, it should not go medial.
Inferior means not like this.
Inferior is this and lateral. Okay. Dry needling for the supraspinatus muscle. So basically what we'll do, we will then mark the this is what we have got. This is the spine of the scapula. Okay, So this is, we have got the supraspinatus muscle originates from the supraspinatus fossa, get inserted over the greater tubercle. Okay. Okay. The pain referral pattern will be around this area, then this like this, lateral side of the arm, lateral epicondyle till the lateral side of the forearm. Okay, just above the wrist line. So that will be the pain referral pattern for the supraspinatus muscle. Okay, you will get two trigger points in the fossa. Just try to palpate. See, one. Okay, the second one here. Okay, patient position sideline. The needle size will use 40 mm. The direction here, we cannot go perpendicular, right? Because we have got the lungs again, then thoracic cavity. So we are not going perpendicular, and even we have got the thin fossa. So supraspinatus fossa will be very thin. Okay. So what we can do? Direction of the needle inferiorly downward. So if you are going deeper, also what will happen? You will touch the spine of the scapula. So nothing is will happen. Okay. So that will be the periosteal packing. Okay. So I am using 40 mm. Angulation should not be okay less than 45.
Around 80% we have to follow.
Yeah. Right. The third one at the greater tubercle. Okay. So at the insertion point you will use 13 to 25 mm perpendicular direction, because most of the time in supraspinatus tendinitis and there will be inflammation over there. So over the greater tubercle perpendicular, 13 to 25 mm depending on the bulk of it. So I can touch the bones now. Clear? So if you want, just pick up this and you can do to and fro, twisting and twirling, anything. Clear?
Landmark, because we know this line of the this.